Welcome back to the REQ podcast. This is Kenzie Terpstra, a journalism intern with REQ, and today I am speaking with Ryan Foran about his experience with WOW Health. Ryan, how are you doing today?
I'm great. Thank you, Kenzie, excuse me.
It's totally fine. Do you want to tell us a bit about yourself, what you do, that sort of thing?
Yeah, I'm a commercial real estate broker. I've been, I guess you could say self-employed, but I work at a large commercial real estate brokerage called Cressa. We're headquartered in Chicago, but we have offices all over the country. But in the traditional brokerage model in real estate, health insurance is always an issue because who pays for it? And generally, the brokers pay for it. And the brokerage offers a window to just certain opportunities. And that's actually how I came across WOW Health initially.
Gotcha. And so, how long have you been using WOW?
Well, I joined Cressa in August of 22. So open enrollment was shortly after that. So it's been just about 2 years, coming up on 2 years.
Gotcha. And then through your experience so far with WOW, how has it compared to traditional health insurance?
Honestly, it's been like magic. I mean, it's really a weird thing to say, and I'm not somebody that goes out of my way to endorse products, but I've told Jawad before that my wife and I have been incredibly surprised and impressed by the whole experience. And we didn't really expect that, honestly. I was literally one of two employees at Cressa who joined WOW Health. And I believe Cressa dropped it when they switched providers this past time around. And so I reached out to Jawad directly and told him that I wanted to stay personally as a WOW Health client. So I could get into a lot of detail. Do you want me to be specific, or where do you want me to be, or how do you want me to be specific?
Really, whatever you want to share. I was definitely planning on asking just some of your favorite aspects of WOW, like through your experience, this just some of the different um avenues of care that they offer, and just generally, how has it been a benefit to you compared to traditional healthcare?
Well, you know, in my previous life and during the pandemic, I have three children of my own. I have an adopted son also who's covered separately for health insurance. But the five of us were paying, during the pandemic and leading up to it, $3,500 a month
Wow.
for family coverage. And oftentimes there was still a reasonably large deductible there. So if you do the math, we were healthy. Nobody was really using the doctor much. We went occasionally when we had the sniffles or COVID or things like that. But generally, we were a young, healthy family, and I was paying roughly, $40,000 a year in after-tax money for health, um, not including copays and other incidental expenses. So, you look at a large period of time, maybe 4 years of spending that amount of money every year. And when I came across WOW Health, I was at a pull my hair out moment with health insurance. It felt kind of ridiculous to me to spend that much money. It was more than my mortgage on my house, and we weren't using it. My family was healthy, and it was such a what if. Insurance is really a what if thing, right? So why
Right.
am I paying so much money for a what if scenario? And I felt very pressured to just not be insured. And I learned about WOW Health. And essentially, the process is very simple. We go into the doctor. We have seen every doctor that we've wanted to see. Um, I don't even worry about whether they take insurance or not. That's not a question that I really deal with anymore with doctors because I just say I'm self-pay. And they
Gotcha.
say, okay. And they don't care because that just means that they don't have to deal with the insurance companies and haggling over the money.
Right.
Um, so I come in, we have our procedures or whatever. Um, we self-pay, and then we submit back to Zion Health Share, which WOW is affiliated with. We've had tremendous customer service experience with WOW. With Zion Health Share. They send you a debit card in the amount that you spent. And we have not had any dispute or argument in 2 years. My son fell and broke his arm and had to have very serious surgery. They covered every penny, no questions asked.
Wow.
You said it.
Healthcare that makes you say wow.
But honestly, again, I don't climb the highest mountain and shout company names often, but we've been very impressed. Our monthly expense has gone down to more like 700, 750 a month, and we haven't come out of pocket. In addition to that, everything's been covered.
That is
So
incredible.
I tell everybody that'll listen to me, I don't know why you're doing traditional health insurance because this is the way to go.
Would you
Um,
say that through your experience with WOW, how likely is it that you would go back to traditional health insurance again?
as long as this option is available to me, I'll never go back.
That is amazing to
Never,
hear.
ever, ever. Why would I go back? The
Right.
system, what I've learned since joining WOW Health is that the system is set up to deal with the middle ground between what an insurer will actually pay and what the doctor charges. So we come in, you present your card, maybe it's a $5,000 procedure, and the doctor knows full well that they're only going to get $1,300 from Blue Cross because they're going to haggle it down. But I come in and day one, it's $1,300 self-pay. I submit 1,300 back to Zion Health Share. Zion Health Share gives me the 1,300. I'm happy. Doctor's happy. WOW Health is happy. Everybody's happy. And there was never any haggling or any in between. So I would never go back.
That is awesome to hear. And so do you also do the dental and vision through
Yes.
WOW?
Yes.
Wow. Okay. And so you haven't had any issues or anything like that trying to find providers for
No.
those?
And we have prescription coverage as well. It's the same thing. Dental and vision insurance is always very weak anyway. It's very, they don't cover most procedures. They'll give you two new sets of glasses a year. This is really the same concept. We come in, we self-pay and we submit and we get coverage. It's pretty much better coverage than direct health ever was. And it's much easier to get face-to-face time with somebody to talk about if you have an issue.
Awesome.
I
That is
found it to be
great.
a revelation. I really have.
That is amazing. Thank you so much for sharing all of that with us. That is, especially honestly, we haven't talked to anybody yet that has a family. Usually it's just an individual or them and their partner. And so to hear that you're able to find all of this care, not just for you, but also pediatrics and child care, goes so much further than just adults that don't
I
need
think
the
the
support.
misconception with health is that providers need you to have a certain type of insurance in order to provide health. Over the last 2 years, I have not changed one doctor. I just tell them, they say, well, what insurance are you going to use? And I say, I'm self-pay. And they all say, okay. No hesitation. Okay. They don't even ask why, what are you doing? What, they don't care. They say, okay. And then I pay self-pay and that's it. And Zion Health reimburses. It's been incredibly um, painless, way better than anything we ever dealt with in the past with much more expensive so-called, big insurance companies. Again, so much so that when my company dropped it, I left the company and took my family privately to WOW Health. And my wife was very skeptical. I wish you could talk to her. Maybe she's next to be interviewed.
Yeah, no kidding. I get that. I get that. I will admit when I first joined the REQ team and I was introduced to Jawad and just kind of everything that was going on, and it's definitely, it seems too good to be true to a degree.
You know what's funny is that before I met Jawad, I had this idea to do exactly, well, I didn't understand the Zion Health Share part. that part I never quite understood. But I have a friend who sold PEO insurance solutions to companies. And the way that works is if you have a company that has maybe 10 employees and you can't access a major insurance program, you join a PEO, which is a group of companies. So now Insperity, for example, is a company out there, and maybe they have 2,000 companies under them, and every one of those employees is now an employee of Insperity for the sake of insurance. So they've now turned themselves into a massive corporation like an Apple or a Microsoft by having, 50,000 employees or something like that. So they have much more buying power. And I always thought, there's got to be a way to do that as an independent contractor, which is I've always been, um, a way to better serve independent contractors. And then after I got to know Jawad, I always thought, hey, if this real estate thing doesn't work out, I'm going to call Jawad. And I'm not kidding because I thought I can help turn this thing into something. I really still believe that there's a huge market for it. I mean, absolutely huge among brokers, independent people like me who are tired of paying proactively thousands and thousands of dollars a month in a preventative format. It's you're paying all this money for comfort. And if you make enough money to pay $40,000 after taxes every year, great. And that makes you feel comfortable, great. You're throwing your money out the window, but okay. But I'm not in that position. So, $700 or $800 feels a lot better to me for a preventative service. And all they're really doing is just they've got my back in the event that things really go sideways. So
Right. Absolutely. That is incredible to hear. Thank you so much for the honesty and just being fully transparent of how this has been for you. Is there anything else that you wanted to add on to this?
I don't think so. I think I've been talking a lot.
I think you did great. That was incredible. Thank you again so much for sharing all of that insight. As I mentioned, we haven't had the opportunity to talk to somebody with a full family that's using Wow Health. And so this is great just to see that and show others that it isn't just for employers to give to employees or just an individual that just doesn't want to do their full-time employee benefits anymore. And this has been truly wonderful, especially just given all
Yeah,
your
I would go so far to say that, in my opinion, if the masses understood it, it's the future of healthcare.
right. And that's a lot of what we're trying to do is people just don't understand how it works because so much of the conversation surrounding healthcare has been taken away from us, the consumers that are looking for providers, because it is you go to the doctor and they say, "What's your insurance?" And you give them your insurance number and you don't hear again until you get a bill saying this is what you still have to pay.
Right. And you have no say in that process. And you don't realize what went on behind the scenes was a lot of haggling and negotiating between the doctor's office and the insurer. And then there's eventually a gap. And then you end up paying for that money anyway, in addition to the outrageous amount that you're paying monthly just to carry around a card with somebody's logo on it. I mean, the only feedback that I would have is that I feel like WoW needs to do a little more of the logo stuff, like kick up the logo because why not? Give everybody a card. It's not that hard. And even if it says, hey, I'm self-pay on it with the WoW logo, I just think even that would be my only suggestion because there's nothing that I can present to them that says WoW Health on it today. And I'm not, you know, embarrassed to be part of that program. I think it's great. I think it's really a unique thing. And I think a lot of people would probably ask me, what is that? What are you doing? Um,
Right.
and as you can see, I'm happy to talk about it.
Right, right. An icebreaker of sorts. And
Yeah.
honestly, just another form of marketing, just having the card to hand to people. I mean, at that point, you might get more providers along the way that join into the community that Jawad has with WoW, that sort of thing.
Well, and it's bigger than that. It's, if I discovered a way to get rid of my electric bill, I'm going to tell my neighbors, hey guys, you should try this. Um, this is something that people don't really understand. And I think that if they did, again, it's a way for a lot of people to save a lot of money. It could be a real game changer.
Yeah, absolutely. Thank you again so much, Ryan, for joining us on the podcast today. This has been super helpful, and you've given a lot of insight, not only to Greg and I, but also to countless other users that may be in the same sort of position and needing a better option to find healthcare that works for them.
Great. Thank you.